Hello and welcome to Beyond the Pill podcast series. On this episode 1, we are going to be looking at what is injectable prep and why it matters.
Saying beyond the pill. And there is a call, conversations around injected prep. So on your own ideology, can you please educate us on injectable prep?
Yeah, thank you very much for this. The fight against HIV has been a long one, and people are already used to the oral medications. And with the current development, we have we are now injectable prep. People can now take some jabs, maybe once in 2 months, instead of the daily daily they assess the drugs, the about, but this time around, we just take the jab and then for 2 months. And so I think it's it's easier and friendly. And then it also helps, because the burden of daily going to the hospital and then the stigma involved when you go to assess your drugs, So those who are dealing with HIV, have an opportunity now to relax at the reduce station, and there will be proper adherence, to taking their medications. Because when they put that once in 2 months, they'll be able to adhere strictly to these medications. Unlike the one you do daily, sometimes they miss hours, and the consequences of not, following the routine of your medication. So this is a positive dimension. I think it's better. And I think that people who are living with HIV also, be happy, understanding this. And also those who are, having that risk of, contracting the HIV, they will also understand that it's better for them. And in this wise, you can talk about the issue of artisanal changes. But part of the thing that I advocate, now that we have seen as funding has been cut in terms of HIV programs and all that, and or medications, there should be a artisanal change. People should be aware of kind of lives they live, so they don't put themselves at risk in this type of game. And then the government should also step up actions towards, assisting people, because the poor people no longer access the medications, especially those who are living with HIV. They don't, the diseases are not subsidized. They will not be able to, they will not be able to access this drug. So the government should also subsidize the injectable prep.
Okay, sir. So I will start with the first one. What is injectable prep? So injectable prep is, well, I will have to start with prep. Prep is pre-exposure prophylaxis. So this particular one is coming in an injectable format, which is that it is going to be injected into the system of the person who is negative, and probably he or she has multiple sex partners, or has a partner who is HIV positive, or he or she prefers not to use condoms. So the injectable prep is going to help this person to prevent him from or her from getting HIV whenever he or she is exposed. Nonetheless, injectable prep Kabla, this particular one, is taking 2 months, and it's more easier and more flexible than the oral prep that is being taken. So people take this to also help them get prevented from getting HIV. Okay. So, and like I said, it's been taken every 2 months, and it works perfectly. It works perfectly and it works accurately. Okay. So the difference between oral prep and injectable is that this one is taken every 2 months, and the pill burden from someone taking oral prep or medications will be reduced. And I also think that there will be high level of adherence with this one, because it's just once every 2 months. Okay, so it covers the person who is to take this, and the person goes his or her way, and is less convenient, is more convenient, and less less burdening, if there's any word like that. So why it matters is that it will help people, one, when they start having access to it, that it will help the adherence level to grow, and for people who have been on oral prep, because we've had incidences of people coming to get enrolled on prep, and afterwards they wouldn't come again for refills or for continued medication. So, but this one, it's going to help people keep up with adherence, maintain HIV negative, for and like maintain people being HIV negative from seroconverting to being positive, because there are high chances of it also aiding people do that, because we've seen a number of cases where people who are negative on prep, and at some point they seroconverted, and you will not ask the person what happened. They said he skipped taking it for so period, and within that period he or she had he or she got exposed either sexually or any other way, and certainly that's what's bringing them. But this one, I think, and also contributing to the fact that people can take this at their convenience, wherever they are at every given time. I strongly believe that it matters, and it's more important. And like I said earlier, it is going to the adherence level is going to be top notch, because people have been reduced the stress of taking daily pills, the pill burden, and the anxiety that comes with taking medications every day, and the less privacy people have taking this. I think the injectable prep covers all of this, and it is beneficial to young people, women, and other high risk groups in Nigeria, because, like I said, it will help reduce the incidences of new HIV amongst young people, amongst women, and other high risk groups in Nigeria, which looks at key population and other sexual minority groups in Nigeria. Thank you very much.
Thank you for listening. It's clear the barriers are real, but we have to keep the pressure on for faster action, better funding, and smarter systems. Join us again as we go even deeper in the next episode. This podcast series, Beyond the Pill, is supported by a grant from Africa Rich. Join us again in the next episode. Bye.